dream we've been able to build a financial protection scheme of different ways and with different phases. Currently, many of them are asking for our support on pandemic preparedness and in public health functions. And that's what we try to do. We bring the financing, but we bring it together with knowledge from all around the world, from best practices from other countries. We bring in analytical work, and we also bring partnerships and a convening and advocacy capacity, because we cannot do this alone. And all of that together, again, in a country-owned model, should help us take, again, the steps in this long journey into better health, especially for the poorest and more vulnerable.
Was the pandemic one of these opportunities you're talking about? Did it build a desire for better health systems among the people of some countries? We know there are some countries that it didn't.
I want to sound optimistic, but I also want to be realistic here, and I'm not naive. It did attract a lot of attention during 3 years, but we're seeing many governments and many institutions now walking away from it. We're seeing the neglect cycle coming in many ways. And we need to resist. We need to be consistent and say, this was important before COVID, it was important throughout COVID, and it remains very important for our societies, building a more resilient health system. Hopefully we can do that together, by the way.
How do you help the population of a country support the development of a proper health system? You mentioned it has to come from the ground up, it can't come from the top down. What are some of the methods you found that have worked?
So my very personal take here, and by the way, I was Minister of Health and Social Protection of my country, and I saw it in reality happening, is that you need to respect communities, and you need to understand that our countries are not uniform. They're very heterogeneous. If you start by that, and the communities in a way lead their own local way, and you on top of that contribute with a long-term vision of what the construction should look like 20, 30, 40 years down the road. That's the most difficult part, by the way. And you look, and you're able to reach a political agreement around that, you can advance. National decisions are very important. Let's say it like that, Maggie. National decisions are very important, but health is local. Health is local. So we need to construct from the community and the local, let's say, choices and priorities. We need to construct from there up. And it's difficult, but it can be done. Let me give a very quick case. Costa Rica has always been mentioned as a clear country that for more than 4 decades has been able, building from the community health, building a strong primary health care network around the whole country, the whole geography, build a very well-performing health system.
Pura vida.
Se puede.
So are there any examples from your recent travels? You said you've been visiting Africa lately. Are there some opportunities you've seen there?
Look, I'm impressed with the efforts of all countries. Last week I was in Mali and in Burkina Faso. By the way, Burkina is facing the displacement of more than 10% of its population because of violence. And nonetheless, the government and the ministry are working intensively on maternal and infant health, and ensuring that in primary health care, the basic maternal and infant services are free of charge and do happen. And I think that's incredible. On another scale, I visited Indonesia, and it's impressive to see Indonesia doing a double hand exercise. On one side, shifting the whole, let's say, financial protection aspects with one of the most ambitious and strong health insurances. And on the other side, working on the healthcare delivery part as well to increase the quality of care from primary health care to diagnosis, to disease surveillance, and all the way up to hospitals. And that combination of health financing reforms with healthcare delivery reforms is also very powerful.
Was Indonesia's government involved in helping that happen?
Of course, they're leading the way. And they were also, by the way, I want to give them credit, fully behind with other countries of the pandemic fund construction that happened last year.
To Does our current global system of having kind of a lot of NGOs handle these problems, has that damaged the efforts to have countries build their own health systems from within?
So let me answer in a positive way. I think all efforts and all contributions are very much needed. The dimensions of the health needs in our communities are huge, but nobody can do that alone. And the civil society brings incredible value in many of those particular agendas, but it cannot replace the ownership by governments. It cannot replace the health system in itself. I think we should all, civil society, the big funding multilateral mechanisms, the big funding funds, always reflect on how we can reach clear indicators and concrete outcomes working within the systems. It's very important. And by the way, an ironic result that many of us have seen, and it's a big concern here, Maggie, is that a lot of the development assistance that is brought top down into many countries, what it does, if it doesn't come through the budget, is that it displaces domestic resource allocation. A Minister of Finance will say, wow, you're getting this money from that fund or from that other, so I'll take this money back into security or transportation or education. And we don't build future sustainability that way. It's an important effort, but again, it will not build sustainability. So I would insist we need to work through health systems with country-led and country-owned processes.
You brought that right to the minute of 10 minutes. You are obviously a very organized person. Is there any last thought you'd like to leave?
No, I would say that my wife doesn't agree with that. No, look, quickly, I think we're in great need. I like a lot what the incoming president of the bank, Ajay Banga, has been saying in his first week. A sense of urgency with what we all need to do together. A sense of urgency in this poly-crisis. And again, nobody can do it alone. Partnerships, collaboration, not competition. Let's come together around countries. Let's join forces in the best way around their priorities. And again, let's be consistent in the long term. Many of you will be leading these things. But if we again have that long-term vision and we work together around country ownership and leadership, I think we will continue to see progress. And again, with an intense equity lens. Intense equity lens. Thanks, Maggie.
Dr. Juan Pablo Uribe, thank you so much.
Thank you.
You are good.